24/7 emergency and urgent care, specialty services. What more really could you want from a veterinarian hospital? And you get all of this, plus a healthy dose of compassion and understanding from the teams at MedVet. So here to explain what goes into this type of emergency critical care for your pet, happy to welcome back to Daytime Dr. Jay Gladden in this sponsored segment. Good to see you.
Good to see you. Thanks for having us back.
Of course. We're going to start out with kind of the basics. And I want to know, Doctor, what falls under this umbrella? When you talk about critical care, what kind of instances are you referring to?
Yeah, so I think a lot of people recognize if a pet's been hit by a car or attacked by another dog, that level of trauma, it's very frightening. You can see those outside injuries, and so certainly that area for those critically ill patients, so we're going to be there for them and provide care. But there are other sort of surprising diseases and illnesses that really can make your pet quite sick and debilitated, and so the critical care service is there to help with those. So anytime your pet is struggling to go to the bathroom, can't breathe, is collapsed and weak, they probably have an underlying medical condition that requires 24-hour care and very intensive care. And so critical care is there when the seconds count and you're very worried about your pet. You need someone that knows what to do in the moment, and that's our area of expertise, is the injured and ill pet, regardless of why they're there.
Yeah, absolutely. All right, so you say too, your vision kind of emergency critical care is a focus on a scholarly yet practical approach. What do you mean by that? What does that mean to someone, right, bringing their pet into you?
Right, so we have to have the brains and the science and the medical background to provide that care, but we have to be practical, right? So our pets, when they come to us, there's a level of care that we have to balance what they need, but also what a pet will tolerate. So as a human, I can have you hold still and put an IV in and help provide care for you, but our pets, we have to work within the reason of what's easy on the pet, what allows them to be cared for without stress and anxiety. So we really try to take a practical medical approach, but apply the kind of modern technology and information that we have available to us to meet what the pet needs and what pet owners need for their pets.
And to that end, as we all know, pets, right, can't tell you I'm in pain, I'm feeling this way, that way, or this is something that's really stressing me out. So let's talk about what pet owners should look for when it comes to an injury when they're at home before they get to you.
Yeah, and I think really we kind of see two things. So mainly just talking about cats and dogs specifically, they're going to be different. So, I think cats are pretty tough in that, all pets can't tell us that they're not feeling well, but your cat's not going to come to you and point that out. So a cat's going to hide disease and illness. They're going to run, they're going to be in the back of the closet or under the bed. So any sort of new hiding behavior for a cat that's not normally a nervous cat is a clear sign that the cat probably needs help, because that's what they're going to do. And they also hide and mask disease. So cats are really going to wait until they cannot hide the illness anymore from you before you find them in a state of distress. So cats you want to sort of bring in as soon as they're showing you outward signs of illness. Dogs make it a little bit easier in that a dog that doesn't feel good tends to want to come to their owner and be extra clingy and sort of, have a different set of behaviors. So most of our owners come in sometimes and they can't pinpoint the exact issue, but they know something's different.
Right.
So I tell people to lean into that instinct when it comes to your dog, because if your dog's coming to you and looking for more attention or is acting out of the normal routine, that's a clear sign that they should come to you. And that may be a first instance that you reach out to our wonderful veterinary community and see your referring vet that knows you and your dog really well, so you guys can get a sense of something else is up. And if you do find an illness or injury that's there, great, we partner with your vet.
Yeah, and I want to talk a little more about that, because you don't say you're a replacement for a family vet. You say we are a partner, right? So what does that mean for somebody, who has a family vet and has loved their pet and pets for forever?
Yeah, they're your first point of contact most of the time, but I think we have to be realistic in that our family vets are humans too, and they can only be awake so many hours and be there for you. So we rely on each other as a partnership, where MedVet is going to be there in the middle of the night, on holidays and weekends when your vet may not be directly available. And when they are, they're going to be able to tell you, hey, this is something we've got you. We can provide care for this injury or illness, because there is a lot of care that they can provide. But they also know when they need to reach out to us and our specialty teams so that we can do things like 24-hour care. They have to sleep sometimes, and we've got great teams that stay up in the middle of the night. And we just have other specialists that have unique disciplines like evaluating the heart or evaluating the brain, which is not something that your family veterinarian is going to have that equipment there and available 24/7.
Yeah, I know we had one of your ophthalmology specialists on, and you don't often think about that as being somebody who would be available for your pet. So it's great to know that there are so many things that you can do to help your pet get better and stay well. Always good. So let me tell people medvet.com. You can reach out to them, as they mentioned, 24/7 care. So also just one of those peace of mind things. Keep that number on hand if you ever need somebody to care for your pet. So Dr. Gladden, thank you.
Thank you for having us.